So, hello everyone. Voice is audible, everyone. So, hello everyone. Voice is audible. Is it clear? Hello. Okay. So we are going to discuss today's forensic medicine session. Okay. Okay. Which paraphilia involves sexual gratification for wearing clothes of opposite sex? Anyone who can give me the answer? Yes. Yes. What is the answer? It is eonism, fetishism. What is the answer? Anyone? Which paraphilia involves sexual gratification for wearing clothes of opposite gender? What is your answer? Wearing clothes of opposite gender. Yes, it is eonism. Eonism is another name of transvestism. Yes, my dear friend. Transvestism was given in option or eonism was given in option? What was the option? Transvestism or eonism? Tell me. Whether option was? Yes. The other options are frotteurism, fetishism. What is fetishism? It is by opposite sex article not wearing clothes. Okay. You can see this was the direct question from the very important notes. Yes. Transvestism is wearing opposite sex of clothes. Transvestism is also known as eonism, and fetishism is by inanimate object of opposite sex. Yes. So here answer is eonism. Eonism is another name of transvestism. You can see the notes indirectly in the notes. These are the notes taken from the PrepLadder only. So the everything comes from the notes. Transvestism or eonism, both are same. Fetishism is फटी हुई चीज से मजा लेना, है ना? Like if I'm satisfied by inanimate object, that is known as fetishism. If I'm satisfied by inanimate object, that is known as fetishism. Okay. Chalo, next question. Okay. Next. This was the question. Identify the given fingerprint pattern. Anyone who can tell me what is the name of this fingerprint pattern? Yes. What was the answer? Loop, whirl, arch, composite. Anyone who can tell me the answer? Loop, whirl, arch, composite. Anyone? Okay. If this was the image, the answer is whirl, because this is the circle. Can you see the circle? These are the circle. The circles are known as whirl. If this was the image, the answer is whirl. But I will show you the images. Yes. The first image, one core, one delta. This is loop. Second image, no core, no delta, arch. Yes. And the third image, if you see, that is 2 delta or 1 to 2 core. That is whirl. So if you see the third image, that has been given in the question. So here answer is whirl. Okay, if this wasn't the image, loop in now whatever the image would be. If the image given is this, yes. If the image given is this, that will be loop. Yes. Okay. If the image given was this, that would be an arch. Yes. And if the image given was this, that will be a whirl. And if there was a mixed pattern, the answer will be composite. Okay. So these are the question on the recall basis. We don't know what was given, but I have shown you all the picture. If the first image is given, that would be loop. If second image is given, that would be arch. Okay. Okay. And the third image, if it is given, it is whirl. And if mixed pattern, the composition of 2 or 3 is given, that would be composite. है ना? मैंने तीनों बता दिए. Yes. Okay. That was composite, which I shown you in LRI. No problem. But what I'm telling you, please be, your concept should be very much clear, beta. है ना? Your concept should be very much clear. If this is the image given, that would be whirl. Okay. Because you can see the circle. And see, if the first image is given, that would be loop. The second image is given, that would be arch. And if there's a mixture of 1 or 2 things like loop and arch are mixed, that would be composite pattern. Okay. And the third image, this would be the image of whirl. So these are few pictures you can get in your exam. Okay, dear. Chalo aage. Next. Now, a male is brought for medical legal examination after sustaining for a firearm injury. On examination, there was a tattooing. I think this was the question. Tattooing was mentioned. No burning, no singeing, no charring was present. Is it clear? This was the question, beta? Tell me, dear. Yes. 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 So only tattooing was mentioned. If, देखो मेरी बात सुनो, if only tattooing was mentioned, what will your answer? Close range, contact range, intermediate range, distant range. Anyone? Can you tell me? If only tattooing was given. Okay. Yes. Yes. Only tattooing was there. So it will be intermediate range. Dr. Sir, here near range is not mentioned in option. Near range is an intermediate range because here near range is no tattooing था close neat वाला टिक किया तो बेटा close तो नहीं होगा in close all three will be mentioned in close all three will be there that will be BBT blackening burning tattoo in contact everything will be in the you can see this is the image yes you can see this is the picture clear picture if only BBT present that will be a close shot only BT or TT is present. Yes, only BT or TT is present. TT is the only tattooing. That will be a intermediate range. Yes, my dear friend. Or in near, it will be a BT only. In distant range, all will be absent. Okay. Now listen, my dear friend. If near was mentioned, listen. If near was mentioned and still tattooing is the only given, the best answer will be intermediate. Okay. In near, yes. Yes. Without any doubt, this is the table you can get in your mind. This BBT present in close shot. Only tattooing was there. If intermediate was given, the answer is intermediate. If BT is given B plus T, that would be a near range. And if all are absent, that will be distant range. Here answer is intermediate. If intermediate is given in option. Yes, this was the exact question as you are telling. Yes. Now, was there a question of NCCT of this one? This is very simple question. Yes. Actually, this is in my PrepLadder notes. Exactly, this is a question of radiology, but actually this is in my PrepLadder notes. So was there a question? Yes. E for EDH and E for Idli shape. Without any doubt, this is a question. Yes, we had that is EDH. Yes, with listed interval, without any doubt. So I told you in the lecture, it was EDH with Idli shape, without any doubt. Okay. So this is EDH. Now tell me, a patient present with opioid overdose, anyone who can tell me, which of the following effect will be seen? Bradypnea, tachypnea, dilated pupil, what is the answer? Anyone who can tell me the, yes, direct question they ask. Anyone who can tell me the fourth option? Bradypnea, tachypnea, dilated pupil, anyone who can tell me the fourth option? Anyone? Here answer is bradypnea, without any doubt. Anyone who can tell me the fourth option? Bradypnea, tachypnea, dilated pupil, and anyone who can give me the fourth option? Yes? Anyone? No. No fourth option. Tachycardia was there. Okay, tachycardia. No problem. Tachycardia was there. Okay. Now, sir, you can see the picture. This I told you in the notes. The morphine is a opioid type, and there are you can see the symptom. Yes, my dear friend, you can see the symptom. Meiosis, orthostatic hypotension, respiratory depression. That is bradypnea. Pain relief, histamine release causes bronchospasm, hypothermia. Increase ICT in frequency. Yes, in frequency, nausea. Naloxone is the antidote. Euphoria and sedation. Now, constricted pupil was given as an option. Anyone? Cricket fever. Constricted pupil was given as an option. Yes. No. Constricted pupil was given as an option. Or dilated pupil was given. Tell me. No. So yes. Yes, without any doubt, it's a bradypnea. Okay. Okay, no problem. Now, this is a very simple question. Was there a question? A 29-year-old male complained about sodomy by his co-worker, from where you will collect specimen within 24 hours. This is the easiest question of your life. The co-worker's sodomy. Sodomy is a anal sex. Sodomy is a anal sex. So from where you will collect the specimen within 24 hours, because spermatozoa can be present till 72 hours. So yes, we will take anal swab for cell and semen. Yes, anal swab for cell and semen. Can you tell me the any other option? Which was the D option? Nail scraping, oral cavity, anal swab. What is the any other option here? Anyone? Can you tell me? What was the D option D? Anyone? Oral cavity for semen, anal swab for cell and semen, nail scraping. Anyone who can tell me the fourth option? No? Yes? Okay. Anyways, this is very simple question. Okay. Chalo, next one. So this I discussed. Okay. This I discussed in, yes, blood serum was given. Blood serum. Okay. So I'm putting it is blood serum. Blood serum was given. Okay. Serum or blood test was given. Okay. Chalo, no problem. Now this I discussed in my notes, PrepLadder notes. As you can see, it's a dried semen in anal or perianal area. This is medical examination of sodomy that I discussed in detail. Now this was a question. This was the question. A young male is brought for medical legal examination under court order to determine the age for criminal liability. Based on the given radiographic finding, what is the most likely age of the accused? Tell me. Tell me. 12 to 14, 14 to 16, 16 to 18, and 18 plus. Yes. Now, sir, here the fusion of this area has not taken place. This area, no, it's not 14 beta. This area has not taken place. I told you 18, 16, 18. That this was the trick I told you. 18. This was the trick I told you. 18, 16, 18. Okay. Or 17 to 18. So this has not been fused. Yes, without any doubt, this has not been fused. So the best answer will be 16 to 18. Other area are fused. So the best answer will be 16 to 18 without any doubt. Okay, we are presuming like the other area are fused, but this is not been fused. So this is not been fused. It will be below 18. It is not 18 plus, because 18 plus, if it is fused, that would be 18 plus. Yes, you remember. Now any question was about delirium tremens was given, yes or no? Any question of delirium tremens was given, yes or no? Anyone who can tell me? Yes. Any question of delirium tremens was given, yes or no? Was there like anxiety, hallucination, anything was given? No? Okay. So this is all about, yes, no problem. Okay, this is all about, I'm emphasizing on all the points. According to me, the forensic was easy to moderate. Why it is easy to moderate? Because it's been taught by me only. So I'm coming to all the question again for you. Yes. Now, can you tell me the remaining option in sexual gratification? Okay, there was a question of disulfiram. What was the question of disulfiram? Anyone? I'll discuss. Don't worry. Okay, what were the remaining option of this? Paraphilia, eonism, fetishism, and what are the two remaining options? Yes, eonism, fetishism. You got all right only just because of you. Okay, alcohol cessation. There was a question. Alcohol abstinence. Exhibitionism. Exhibitionism was an option. Anything? Anything else? Anything else? Okay, alcohol cessation, alcohol abstinence, we have disulfiram. Patient is on disulfiram. Okay. Curculing. Curculing. What is curculing? किसमें था बेटा curculing? What was the fourth option here? Eonism, fetishism, exhibitionism. Was it a voyeurism? Okay, there was a question for impotence to a single woman. If it is a impotence to a single woman, the answer will be quad. Okay, so I'll put in a separate query. the importance. So first of all, let me finish. Voyeurism is not sure. Okay. Okay. This was the first question. Yes. This was the fingerprint. If this was given, this is whirl. Otherwise, mixed pattern is a yes. Okay. Mixed pattern is that one. Okay. Now, this was a question. This is intermediate range if only tattooing. Yes. This is the slide. Okay. This is EDH. Okay. Done. This is bradypnea in opium overdose. Yes. That is done. This is anal swab for cell and semen. That is done. Yes. This was a question. And this is 16 to 18 years of age. You made FMT very easy. Thank you very much. Thank you. Now, you are saying the next question was quad. Quad is a important. If you are important for a particular woman or particular man, that is known as quad. Was that a question? ये question था बेटा? ये question था. अच्छा, one of the option was urolagnia. One of the option was urolagnia. Okay, okay, okay. Mixed pattern of the fingerprint was composite. Okay. So quad is a person who is important if you are important for a particular person. Okay. So what was the line of the question? If you are important, can you elaborate with the line of the question? Quad का question क्या था? Quad का question क्या था? हाँ बच्चों? Yes sir. Ground for she took for divorce and doctor found quad. Okay. So नहीं question क्या था बेटा? कुशाग्र. What was the question? What is quad? That was the question, or she got a divorce because of quad. Okay. 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 Importance towards the wife. If a husband is important towards wife, that is known as quad. Okay. Anyways, but not for other women. Yes. एक आदमी एक औरत के लिए नामर्द है, बाकी के लिए मोस्ट वेलकम है. तो उसको बोलते हैं quad. Very good. This is quad. Quad on hunk. Quad on hunk. Chalo, done. So I think this was a very easy session for forensic medicine 9. Why it was very easy? The paper was like moderate to hard, I think. Okay, a person died in burn injury, fracture in injury can be identified by what test? Like something they asked. If the person died and because of burn injury, okay, they can identify the fracture or injury by which method? Okay, so if they can identify the fracture or injury, what were the option? Anyone? What were the option? Whether there was a option like virtual autopsy? Yes, virtual autopsy was the option. Yes, very good. Virtual autopsy is a autopsy. We do CT scan or MRI. Virtual autopsy is autopsy. We do CT scan or MRI, so we can identify the injury. देखो डॉक्टर साहब, दोनों बातें अलग है. If you want to identify the fracture or injury, the answer is virtual autopsy. And if you want to identify, option are photography. No, photography is not there. Yes, yes. Conventional photography not needed. Virtual autopsy is the answer. Okay. But if you want to identify the dead body, the answer would be DNA. But I think if the fracture and injury has to be identified, the internal injury and fracture, the answer will be virtual autopsy. The answer will be virtual autopsy. Okay. इसका मतलब in forensic we got almost 10 plus MCQ according to me, like, है ना? Yes, that is it. The question था कि सर कल बर्न पेशेंट है और उसके इंटरनल ऑर्गन की चेक करना है, तो आप क्या करोगे? That is the virtual autopsy. Yes, without any doubt. So there are many questions, है ना? स्टूडेंट पहले बोले सर फोरेंसिक में बहुत कम आया, but according to me like there are 10 plus MCQ from forensic medicine. Okay. Quad, you are important for a particular person. I will put this in my PPT. And virtual autopsy, the person is died and you want to identify the fracture and injury, the answer will be what? So all the question are directly from the notes only beta. सारे question है ना notes में से. Also, there was one more question for finishing a DNA of a person who died in building collapse. Not sure, but some disaster. How to confirm DNA of died person with family member? Probably this question is a question of biochemistry, because we confirm the DNA of a died person with family member by some DNA technique. That would be a question of सर फोरेंसिक तो पता नहीं चली, तो देखो आप एग्जाम में व्हाट इज अ क्वेश्चन नंबर 1. HLA matching was a question, that was a question of pathology. Okay, second virtual autopsy was a question. Okay, this question 16 to 18 year, fourth this question, fifth this question, sixth this question, seventh this question, eighth this question, ninth this question. Yes, ninth I have discussed 9 or 10 question here, so this is very important. Okay, okay, चलो. So these are the question of forensic medicine, my dear friend. आराम से सो जाओ. Good night everyone. और बाकी इसके फाइनल पीपीटी I'll prepare and I'll final PPT. Okay. ठीक है बेटा. चलो. Yes. What is a person who is important to a particular person? And in died patient, the fracture and injuries by virtual autopsy. Okay. चलो. चलो. Good night everyone. Bye bye. Take care. Best wishes for exam result. सब खुश रहो. मस्त रहो. Bye bye. नहीं इतना टफ पेपर नहीं था, थोड़ा सा ट्रिकी था और थोड़ा सा लेंदी था. चलो, टेक केयर, बाय बाय, गुड नाइट, गुड नाइट.